Welcome. Today we're diving into Voriconazole, a crucial antifungal medication. We'll explore its role in therapy, how it's metabolized, and why therapeutic drug monitoring is essential. Whether you're a healthcare professional or just curious, this video will break down the key concepts from genetic differences to dosing strategies. Let's start by understanding where Voriconazole fits in the treatment landscape and why it's considered a first-line option for several serious fungal infections. Voriconazole is the first-line therapy for invasive pulmonary aspergillosis, cytosporosis, and fusariosis. These are severe fungal infections that can be life-threatening, especially in immunocompromised patients. Additionally, voriconazole is used as a first-line prophylactic agent for high-risk hematology patients, helping prevent fungal infections before they start. Its broad spectrum and proven efficacy make it a go-to choice in these challenging clinical scenarios. Understanding voriconazole's pharmacokinetics is key to optimizing its use. It boasts a high oral bioavailability of 96%, meaning most of the drug is absorbed when taken by mouth. Its volume of distribution is 4.6 liters per kilogram, and about 58% binds to proteins in the blood. Voriconazole is primarily metabolized in the liver, mainly by the CYP-C19 enzyme, with minor roles for CYP-C9 and CYP3A4. Less than 2% is excreted unchanged in urine, and its half-life varies depending on the dose. Voriconazole dosing starts with a loading dose of 6 mg/kg every 12 hours on the first day, followed by a maintenance dose of 4 mg/kg every 12 hours. This approach helps achieve therapeutic levels quickly. If an intravenous loading dose is used, steady-state concentrations are reached by day 3. Without a loading dose, it may take 5 to 8 days to reach steady state. These strategies are designed to balance efficacy and safety, especially in critically ill patients. Unique aspect of voriconazole is its metabolism by CYP-C19, which varies greatly between individuals due to genetic polymorphisms. Some people metabolize the drug quickly, while others do so slowly. This genetic variability can significantly impact drug levels, efficacy, and risk of side effects. Understanding a patient's CYP-C19 genotype can help tailor therapy and avoid complications. CYP-C19 phenotypes range from ultra-rapid to poor metabolizers. Ultra-rapid and rapid metabolizers process voriconazole too quickly, often requiring alternative antifungals like isavuconazole or liposomal amphotericin. Normal and intermediate metabolizers can usually start with standard dosing. Poor metabolizers, who process the drug very slowly, are also advised to use alternatives due to the risk of toxicity. Knowing the patient's phenotype guides safer, more effective therapy. Voriconazole requires therapeutic drug monitoring, or TDM, because of its narrow therapeutic index and nonlinear kinetics. Small changes in dose can lead to large changes in blood levels, increasing the risk of toxicity or treatment failure. Genetic differences in metabolism further complicate dosing. TDM helps ensure that drug concentrations stay within the target range, maximizing efficacy while minimizing side effects. Need for TDM in voriconazole therapy stems from its unpredictable pharmacokinetics. Nonlinear kinetics mean that doubling the dose doesn't simply double the blood concentration. Combined with genetic variability in metabolism, this makes routine monitoring essential. TDM helps clinicians adjust dosing to achieve optimal therapeutic levels, reducing the risk of both underdosing and toxicity. Voriconazole, the most important pharmacodynamic (PKPD) index, is the trough concentration relative to the minimum inhibitory concentration, or trough MIC. This parameter is used to optimize dosing, as the area under the curve AUC directly correlates with trough levels. By targeting the right trough concentration, clinicians can ensure effective treatment while minimizing adverse effects. Recommended target trough concentration for voriconazole is between 1 and 5.5 micrograms per milliliter for most infections. For invasive aspergillosis, levels above 2 micrograms per milliliter are preferred. However, concentrations above 5 to 5.5 micrograms per milliliter are associated with a fourfold increased risk of toxicity. Careful monitoring helps maintain levels within this therapeutic window. Patients often require different dosing strategies due to slower metabolism of voriconazole. The recommended regimen is 6 mg/kg every 12 hours on day 1, then 3 mg/kg every 12 hours to prevent overdose. The half-life is prolonged, and steady-state concentrations are delayed. Therapeutic drug monitoring is usually performed on day 5 if the patient's condition allows, to avoid adverse effects. Non-Asians, the standard dosing is 6 mg/kg every 12 hours on day 1, followed by 4 mg/kg every 12 hours. The half-life is not prolonged, and steady state is typically reached by day 3. Therapeutic drug monitoring is recommended on day 3 to ensure efficacy, as subtherapeutic levels are more common in this group. The target concentration for safety is less than 5.5 mcg/ml. The objectives of TDM differ by ethnicity. In Asians, the main goal is to prevent adverse effects due to higher drug exposure. In non-Asians, TDM aims to improve efficacy as subtherapeutic levels are more common. These differences highlight the importance of individualized therapy and careful monitoring for all patients. For Asians, the target trough concentration is at least 1 mcg/ml for efficacy and less than 4 mcg/ml to prevent toxicity. For non-Asians, the efficacy threshold is the same, but the safety threshold is higher, at less than 5.5 mcg/ml. These differences are based on pharmacokinetic studies and real-world experience, ensuring optimal outcomes for diverse patient populations. Genetic polymorphisms in CYP-C19 significantly impact voriconazole metabolism and dosing. Ultra-rapid and poor metabolizers often require alternative therapies, while normal and intermediate metabolizers can use standard dosing. Genetic testing can guide therapy, but TDM remains essential for all patients due to the drug's narrow therapeutic window. Clinical guidelines, such as those from the Clinical Pharmacogenetics Implementation Consortium, CPIC, provide recommendations for voriconazole therapy based on CYP2C19 genotype. These guidelines help clinicians choose the right drug and dose, improving patient safety and outcomes. Staying updated with these recommendations is crucial for optimal antifungal therapy. Consider a high-risk hematology patient starting voriconazole prophylaxis. Genetic testing reveals they are a CYP2C19 poor metabolizer. In this case, guidelines recommend switching to an alternative antifungal to avoid toxicity. This example highlights the importance of integrating pharmacogenetics into clinical practice for safer, more effective care. Now imagine a patient with a normal CYP2C19 genotype. Standard voriconazole dosing can be initiated, but TDM is still performed to ensure therapeutic levels. This approach balances efficacy and safety, demonstrating the value of both pharmacogenetics and drug monitoring in routine care. Voriconazole levels exceed 5.5 mcg/ml, the risk of toxicity increases sharply. Symptoms may include visual disturbances, liver dysfunction, and neurological effects. Dose reduction or switching to an alternative antifungal may be necessary. Regular TDM helps detect high levels early, allowing prompt intervention and improved patient outcomes. Voriconazole is a powerful antifungal with complex pharmacokinetics and significant genetic variability in metabolism. Individualized dosing, guided by genetic testing and therapeutic drug monitoring, is essential for safe and effective therapy. By understanding these principles, clinicians can optimize treatment for each patient, reducing risks and improving outcomes. Thanks for joining this deep dive into voriconazole therapy. We've covered its indications, pharmacokinetics, the impact of genetics, and the importance of therapeutic drug monitoring. Remember, personalized medicine is the future, and tools like TDM and pharmacogenetics are making treatments safer and more effective every day. Stay informed and always tailor therapy to your patient's unique needs.